Right now, there are over 33 million American seniors enrolled in Medicare Advantage plans. And every single year, that number keeps growing faster and faster. But here is the question that almost nobody is asking. Are all those seniors actually making the right choice for their health and their finances? Because the truth is Medicare Advantage and Original Medicare are two completely different programs. They work differently, they cost differently, and they cover you differently. Choosing the wrong one for your specific situation could cost you thousands of dollars, restrict your access to the doctors you love, and leave you with serious coverage gaps right when you need your insurance the most. So in this video, I'm going to give you the honest, unbiased, and complete truth about Medicare Advantage versus Original Medicare in 2026. No sales pitch, no confusing government language, no insurance jargon. Just clear, simple, and honest facts that will help you make the most important healthcare decision of your life. I am going to walk you through exactly what each program is, how they work, what they cost, their real pros and their real cons, who each one is right for. And at the end, I will give you my honest recommendation based on your personal situation. By the end of this video, you will know with complete confidence which plan is right for your life, your health, and your budget in 2026. So stay with me, because this information could save you thousands of dollars and protect your health for years to come. Let us start from the very beginning so everyone is on the same page. Original Medicare is the traditional federal health insurance program that has been serving American seniors since 1965. It is run directly by the United States federal government, and it has two core parts. Medicare Part A is your hospital insurance. Think of Part A as the coverage that protects you when something serious happens and you need inpatient care. Part A covers inpatient hospital stays when you are admitted as a hospital patient. It covers skilled nursing facility care when you need to recover at a nursing facility after a qualifying hospital stay of at least 3 days. It covers hospice care for patients with a terminal illness, including pain management, counseling, and support services for both you and your family. And it covers home health care when your doctor orders skilled nursing or therapy services to be delivered at your home. Most people receive Medicare Part A completely free of charge as long as they or their spouse worked and paid Medicare taxes for at least 10 years. That covers the vast majority of American seniors. Medicare Part B is your medical insurance. Think of Part B as the coverage that handles your everyday healthcare needs outside of the hospital. Part B covers doctor visits, whether it is your primary care physician or any specialist you need to see. It covers outpatient care, including emergency room visits, where you are not admitted as an inpatient, outpatient surgery centers, and outpatient clinics. It covers preventive services, including your annual wellness visit, flu shots, cancer screenings like colonoscopies and mammograms, and many other preventive measures that can catch health problems early, many of which are completely free to you with no cost sharing. Part B also covers durable medical equipment like wheelchairs, walkers, oxygen equipment, and blood sugar monitors. And it covers outpatient mental health services, including therapy and counseling. Part B is not free. In 2026, the standard monthly premium for Medicare Part B is $174.70 per month. This is automatically deducted from your Social Security check if you receive one. After you meet your annual Part B deductible of $240, Medicare pays 80% of approved costs, and you are responsible for the remaining 20%. And here is the critical thing to understand with Original Medicare. Alone, that 20% has absolutely no limit. There is no cap on your out-of-pocket costs under Original Medicare by itself. Now here is one of the most powerful features of Original Medicare that many people overlook. With Original Medicare, you can see any doctor, any specialist, or any hospital anywhere in the entire United States as long as they accept Medicare. And the overwhelming majority of doctors and hospitals across the country do accept Medicare. This gives you complete freedom and flexibility to choose your own healthcare providers without needing referrals, without prior authorizations, and without worrying about whether someone is in your network or not. Now let us talk about Medicare Advantage, also officially called Medicare Part C. Medicare Advantage is an alternative way to receive your Medicare benefits. Instead of getting your coverage directly from the federal government through Original Medicare, you choose to receive your benefits through a private insurance company that has been approved and contracted by Medicare. These private companies, well-known names like Humana, Aetna, United Healthcare, Cigna, and Blue Cross Blue Shield, receive a fixed monthly payment from the federal government to provide your Medicare benefits. By law, these companies are required to cover everything that Original Medicare covers. But on top of that, they can also offer extra benefits that Original Medicare does not include. Things like routine dental care, routine vision care, routine hearing care, fitness memberships like Silver Sneakers, meal delivery services after a hospital stay, and even over-the-counter allowances for everyday health products. Most Medicare Advantage plans also bundle prescription drug coverage, which is Medicare Part D, right into the plan. So instead of managing separate Part A, Part B, and Part D plans, you have everything bundled together into one single convenient plan. And here is the feature that attracts millions of seniors every year: many Medicare Advantage plans come with a $0 monthly premium. You still pay your standard Medicare Part B premium every month, but the Advantage plan itself costs nothing extra on top of that. When you hear zero premium, extra dental, extra vision, and everything in one plan, it sounds almost too good to be true. And for some seniors, it genuinely is a great deal. But for others, it can be a costly mistake. And that is exactly what we are going to figure out together right now. Let me now compare Original Medicare and Medicare Advantage directly across the 5 most important categories that affect your daily life. With Original Medicare, you have complete and unrestricted freedom to see any doctor, any specialist, or any hospital in the entire country that accepts Medicare. No network, no referrals, no restrictions. If you want to see a specialist at the Mayo Clinic in Minnesota or the Cleveland Clinic in Ohio, you can do that with Original Medicare. Your doctor makes your healthcare decisions, not an insurance company. With Medicare Advantage, you are typically restricted to a specific network of doctors, specialists, and hospitals that have contracted with your particular plan in your area. If you go outside that network, you will often pay significantly more, sometimes the full cost of the visit. Many Advantage plans also require you to get a referral from your primary care doctor before you can see a specialist. This adds a step and sometimes a delay to getting the care you need. With Original Medicare alone, there is no annual out-of-pocket maximum. That 20% coinsurance has no ceiling. If you have a very expensive medical event, your costs could be enormous. This is exactly why many people who choose Original Medicare also purchase a Medicare supplement, also known as Medigap, plan to cap their out-of-pocket exposure. With Medicare Advantage, there is a legal annual out-of-pocket maximum. In 2026, that limit cannot exceed $9,350 per year for in-network services. Once you reach that limit, the plan pays 100% of covered costs for the rest of the year. This cap provides a very real financial safety net, especially for seniors who face major health events. Original Medicare covers medical services only. It does not cover routine dental cleanings and fillings. It does not cover routine eye exams or eyeglasses. It does not cover hearing aids or hearing exams. It does not cover gym memberships or fitness programs. These are gaps that many seniors discover the hard way after they enroll. Medicare Advantage plans frequently Include all of these extras at little or no additional cost. For seniors who need regular dental care, vision correction, or hearing assistance, these extra benefits can represent hundreds or even thousands of dollars in annual savings. Original Medicare does not include prescription drug coverage. You must enroll in a separate Medicare Part D drug plan and pay an additional monthly premium for that coverage. Most Medicare Advantage plans include prescription drug coverage built right into the plan at no extra premium. This simplifies your coverage significantly, and for many seniors results in lower overall drug costs. With Original Medicare, your doctor decides what treatment, test, or procedure you need, and as long as it is medically necessary, Medicare covers it. There is very little bureaucracy or pre-approval process involved. You and your doctor are in control. With Medicare Advantage, your plan may require prior authorization before approving certain treatments, procedures, specialist referrals, medical equipment, and even some hospital stays. This means a private insurance company has the authority to review and potentially deny care that your doctor has recommended as medically necessary. In recent years, prior authorization denials have become a significant and growing concern with Medicare Advantage plans. Let me now give you the strongest and most compelling arguments in favor of choosing Original Medicare. The first and biggest advantage is complete freedom to choose any doctor anywhere. If you have long-established relationships with specific doctors, specialists, or hospitals, this freedom is absolutely priceless. You never have to worry about losing access to your trusted healthcare providers because of a network change. With Original Medicare, you are covered everywhere in the country. Whether you live in Florida during winter and Maine during summer, whether you travel extensively across the country, or whether you simply want to know that you are covered anywhere you go, Original Medicare has you completely protected coast to coast. Original Medicare has existed since 1965, and its core coverage rules are set by the federal government. Medicare Advantage plans are run by private companies and can change their networks, their benefits, their premiums, and their coverage rules every single year. They are required to give you 60 days notice of significant changes, but those changes can be dramatic and disruptive. When you combine Original Medicare with a Medicare Supplement Plan G, you get extremely comprehensive coverage. Medicare pays 80%. Plan G pays most of the remaining costs, and your total out-of-pocket beyond your monthly premiums and your annual Part B deductible is essentially zero. You get the freedom of Original Medicare with the financial protection of a supplement plan. Now, let me give you the strongest arguments in favor of choosing Medicare Advantage. For seniors on a fixed income or a tight retirement budget, a $0 premium Medicare Advantage plan is genuinely attractive. When you compare $0 per month for an Advantage plan versus $100 or more per month for a Medigap supplement plan, the monthly savings are very real. Having a legal cap on your annual healthcare costs gives you financial protection that Original Medicare alone simply does not provide. Knowing that your worst-case scenario is capped at a specific dollar amount can provide real peace of mind. Routine dental care, vision care, hearing aids, gym memberships, meal delivery, and over-the-counter allowances are real and tangible benefits that add genuine value to many seniors' lives. For someone who needs regular dental work or hearing aids, these benefits can save significant money every year. Having your hospital coverage, your medical coverage, and your drug coverage all bundled into one single plan with one insurance card and one set of rules genuinely simplifies your healthcare management. So who should choose Original Medicare? Choose Original Medicare if you have serious, complex, or chronic health conditions that require regular specialist care. The ability to see any specialist anywhere without referrals or network restrictions is invaluable when your health depends on it. Choose Original Medicare if you travel extensively or spend significant time in different parts of the country. Your coverage travels with you everywhere. Choose Original Medicare if you have strong and trusted relationships with specific doctors, specialists, or hospitals that you absolutely do not want to risk losing access to. Choose Original Medicare if you want coverage that is stable, predictable, and not subject to annual changes made by a private insurance company. And most importantly, choose Original Medicare if you can afford to pair it with a Medigap supplement plan. The combination gives you the best of everything: maximum freedom, maximum coverage, and maximum peace of mind. Who should choose Medicare Advantage? Choose Medicare Advantage if you are in generally good health, do not see many specialists regularly, and want to minimize your monthly premium costs as much as possible. Choose Medicare Advantage if you want extra benefits like dental, vision, and hearing that are genuinely important to your daily quality of life. Choose Medicare Advantage if all of your preferred doctors and your preferred hospital are confirmed to be in the plan network, and you are comfortable staying within that network for your care. Choose Medicare Advantage if you want the protection of an annual out-of-pocket maximum without paying the additional premium cost of a Medigap supplement plan. But if you choose Medicare Advantage, please do this one critical thing. Every single year during the annual open enrollment period from October 15th to December 7th, review your plan carefully. Check that your doctors are still in network. Check that your medications are still covered. And compare your current plan against other available plans in your area. Plans change significantly from year to year, and what was a great plan this year may not be the best option next year. Let us do a final complete recap of everything we covered today. Original Medicare gives you complete freedom to see any doctor anywhere in the country. It is stable, predictable, and pairs perfectly with a Medigap supplement plan for comprehensive protection. It is ideal for seniors who value choice, flexibility, and long-term stability in their healthcare coverage. Medicare Advantage gives you extra benefits beyond what Original Medicare provides: an annual out-of-pocket maximum, and often a lower monthly premium. It is ideal for generally healthy seniors who are comfortable with network restrictions, want extra perks, and want to keep their monthly costs low. Neither one is universally better than the other. The right choice depends entirely on your personal health situation, your financial circumstances, your preferred doctors, your prescription needs, and your lifestyle. My honest recommendation, if you can comfortably afford to pair Original Medicare with a Plan G supplement plan, do it. The combination of complete freedom plus comprehensive financial protection is simply unmatched. But if your budget makes that combination difficult, Medicare Advantage can absolutely be a solid and smart choice, as long as you choose your plan carefully. Verify your doctors are in network and review your plan every single year. If this video helped you understand the real difference between Medicare Advantage and Original Medicare, please give it a thumbs up right now. It helps this channel reach more American seniors who need this exact information to make the right decision for their health and their future. And if you want to keep learning about Medicare, including how to avoid the late enrollment penalty, how to compare plans in your zip code for free, how much Medicare really costs in 2026, and whether Medicare covers dental, vision, and hearing, subscribe to Dr. Natasha Malkova right now and hit the notification bell so you never miss a new video. New videos every single week, all in plain simple English, all completely free. Thank you so much for watching. I will see you in the next one. Take care of yourself.